So if you're watching this, you're at least dealing with shoulder pain, and if you haven't been offered one of these interventions, you're probably thinking about doing something for that pain, whether it's stretch therapy, massage, acupuncture, on the medical end, some sort of injection, possibly even surgery, and in the middle, some form of physical therapy or rehab, which is obviously what we specialize in here. My goal here is just to work through how I feel all of those things are best utilized, when to lean towards one of them, when to not lean towards one of them, and to better inform you as you move your way through this whole process. Let's start on the more passive and conservative end with what I call a lot of the feel-good type therapies, whether it's acupuncture and massage therapy, stretch therapy, things along those lines. And I don't want to degrade them by saying the feel-good therapies, but by being passive in nature, what they're doing is they're helping, whether it's relieve tension, decrease muscle tone, bring pain down a threshold, and that's very valuable. The upside is that you can use that as a mechanism to feel good, to then do something that's going to be a little bit more permanent. So how we personally use those adjuncts is if someone has such a high level of pain that they're having trouble loading something, exercising in a specific manner that we want them to be able to load to move forward, we might suggest that they do something along those lines to help temporarily take down the nervous system, the pain signals, so that we can better do our work here in structuring a individualized plan for them to get back and hit their goals in terms of building capacity, strength, power, all of those things. Now, on the other end, on the medical spectrum, something like steroid shots, which are basically an anti-inflammatory shot, PRP, which is platelet-rich plasma, which is often used in tendinopathies or tendinitis to help accelerate the healing process. All of those things have their place, and I will say that cortisone or steroid injections typically get demonized in one sense because, in my opinion, they are truly overutilized, or at least not properly utilized in conjunction with other therapies. But don't underestimate the power of a well-placed, well-timed cortisone injection. It's basically like taking a bottle of Advil and injecting it very locally into an area that has inflammation. And I've dealt with it myself. Inflammation in the shoulder specifically can be very irritating. And a lot of times movement or rest or ice, oral NSAIDs like Advil, Tylenol, those things, they won't address that inflammation. My recommendation is that if you are recommended to get some sort of an injection, you do it with a provider who is using guided injections, meaning they don't just come in the room with their PA and pop it into the back of your shoulder. They're going in with an ultrasound or some other device to know exactly what their target structure is, and they're able to see exactly where the needle placement goes. So if you have some sort of inflammation in a bursa sac underneath the deltoid muscle on the side here, then you want that injection to be as local to that bursa sac as possible because you are going to see the max effectiveness. I had shoulder pain a few months back, and I had one injection that clearly just missed the site. It didn't do a thing for me. A few weeks later, I was referred to another practitioner. The same type of injection placed in a different spot with more precision completely resolved my shoulder pain, and I was able to then build capacity, resiliency through training and range of motion work and everything that we'll talk about next. So on the medical side, really positive interventions when they're used at the right place, at the right time, for the right person, in the right manner. On the very passive side, a really good way with massage therapy, acupuncture, stretch therapy, what have you, even more traditional chiropractic care in terms of joint manipulation to achieve some range of motion and a decrease in pain. Now, the sweet spot, and yes, I'm biased because this is what we do, but the literature and the research also shows that this is the most effective way to create long-term results and long-term resiliency, is some form of therapy. You can think of it as physical therapy. We refer to it as rehab, strength training, what have you, just because it's very similar with anybody that's coming in. You know, there's no proprietary way to get stronger and get more resilient. And that is to build a long-term plan as to how you're going to move yourself forward, achieving the things that you want to achieve physically and whatever your goals might be. Typically what I see with pain and injury is that people have a threshold where their body can't handle the capacity anymore. Take this simply put, that a runner wants to be able to run 10 miles. They go out and run 10 miles, but they've only really trained to run 6. And so you're going to have this gap where pain or injury is more likely to occur. Typically we see that with the shoulder. Maybe the shoulder doesn't have enough range of motion to comfortably get overhead, but the person is forced to repetitively do something at their house where they're screwing in a light bulb, and now all of a sudden there's irritation. It can be more extreme where you're an athlete who's powerlifting or Olympic lifting and you're pressing heavy weights overhead. Maybe you don't have the right mechanics or the right conditioning to do that amount of load over that amount of time. So at the end, what we have to try and do is figure out a way to get you from where you are to where you want to be, build a plan to gradually scale your ability to get strong, to get more resilient. That's going to increase the capacity. Now, all of these things can be used in conjunction, and we have used them that way. I've sent people out for a consultation for an injection to calm down inflammation so that we can work better in the gym and in the weight room. I've sent people to a massage therapist to decrease their pain response so that we can better move the body. None of these things should be used necessarily in isolation. However, if you want long-term success, you are not going to get that simply through passive therapies. You're also probably not going to get that through some sort of injection or pain reliever. It largely acts as a band-aid, a window that allows you to do the more important work, which is getting strong, getting resilient, and moving yourself forward.